I am Dr. Brent Chuma. I'm a sports chiropractor and strength and conditioning coach. I have a practice called Surf to Summit Spine and Sport based out of Hingham, Massachusetts. Data is essential for improving running performance because of the fact that running happens in real time. There's so much that we can't see with the naked eye, and so it's important to understand what's happening at the microscopic level so that we can really identify risk for injury or risk for recurrence of injury. This is where gait analyses come into play when it comes to understanding what's happening on the first mile of the run versus the 10th mile of the run. Really being able to understand what it is that the athlete changes in their stride mechanics when it comes to, struggling with fatigue or increasing heart rate as they progress in their training runs. The way I've designed my practice and my approach to taking care of athletes is to really gain the data that allows us to identify risk for injury or prevent the recurrence of injury, and then use that data to customize their treatment plan. At Human Powered Health, I'll have my athlete complete a gait analysis and a force plate analysis. Then using that information, I will plug into their training plan specific exercises to help hone the strengths and train away the weaknesses so that we can improve overall performance while limiting the risk for injury. When it comes to the technology and its use to provide insights around the runner's biomechanics, and specifically in my case, muscle physiology or tissue healing, it's great to understand how an athlete either compensates to avoid an injured segment or how they have kind of retrained their own gait through past injury. And being able to use the gait analysis and the biomechanical analysis, where we look at body segments, torso rotation, core stability and strength, and then use that information to get a lot more specific around the athlete's training. We basically make sure that they're not just going through the motions, they're not just checking boxes. Everything that we design and program for our athletes is specific to the needs based on what we gathered during the gait analysis. The thing that I would want runners to understand who are hesitant when it comes to incorporating data into your training is that you don't know what you don't know. Looking is the first step, and having awareness around, maybe it's an asymmetry between your left and your right side in terms of ground contact time, or maybe it's a specific gait pattern that puts you at higher risk for knee pain and knee injury versus low back pain. But without knowing that, then you just move forward kind of without a compass. Using that information and the training and treatment plans we design help you get your performance to the next level, and do so in a way that avoids a lot of the risk for injury that we see out there in the running population nowadays. If you've got a running goal, the fastest way to achieve that goal is with the right data. My patients get that data from Human Powered Health.